Today's Friday, April 9th. This is UCR Health's Clinical and Administrative Programs info session today. And we're very honored to be supported by HPAC, so we're very excited to do this event today. I will inform all of you that this event will be recorded, and it's currently being recorded right now. So, and it will be posted on the HPAC YouTube channel in about a week from now. So if you guys have any other friends who are interested in this program who weren't able to attend this event, please let them know that they'll be able to see this info session soon. Okay, cool. So Brian, we can go ahead and get started.
Thanks, Anuja. So before we get straight into the PowerPoint, I just want to introduce our leadership team. My name is Brian Ho. I'm the current director of the program. I'm a third-year public policy major with an interest in pre-health administration, and I came in with the first cohort of our program in around December 2019 to January 2020, and I came in as a pre-administrative intern.
And then, hi everyone, my name is Anuja Samant. I'm the current assistant director of CAP, and I'm currently a third-year neuroscience major. And I originally started in CAP, I would say June of last year, so June of 2020, and I started as a healthcare administration intern. So yeah, that's a little bit about me, and my career track so far right now is pre-medicine.
Thanks, Anuja. And for the rest of our team, we have Rebecca Riddle, which is our program coordinator. We have Shivam as our outreach coordinator, as long as Chloe as the other outreach coordinator. And Celia, would you like to introduce yourself?
Yes, thank you. I'm Celia Scoggins, and I'm the Director of Ambulatory Operations for UCR Health, but I also serve as the staff advisor for the clinical and administrative program.
Thank you, Celia. So a little bit about our program. The Clinical and Administrative Program was created to provide networking experiences for all of the undergraduate students of UCR. And our mission is primarily to educate our interns to embrace healthcare, all the different aspects of healthcare, as well as aspiring healthcare professionals to be well-versed in both the clinical and administrative aspects.
Okay, so who can apply to this program? So right now we're looking for current full-time undergraduates at UCR. They must have a cumulative GPA of 2.5 or higher. And we're looking for interns for the entire academic year from summer all the way to spring quarter of next year. You must commit to a minimum of 6 hours per week. And right now we are remote for our administrative offices, but in the future, if we do move into in-person, we expect the interns to have reliable transportation to assigned clinics or administrative buildings. So who are we looking for? For a little bit more context, so we're open to all majors at UCR. So you don't have to be just a science major or someone only interested in pre-medicine. We're looking for people who are just interested in healthcare. So you can be a business major, engineering major, any type of major, any type of college from UCR. We're looking for diverse career interests. So again, like I said before, not just practicing medicine. We're not exclusive only to that. We're open to all types of career interests: nursing, public health, project management, and so on. Our ideal candidates are reliable, punctual, professional, and they must have strong communication skills and team-oriented. And like I said before, we're looking for interns who are interested in learning about all aspects of healthcare. So regardless of your interest, whether that be clinical or the administrative side, we are looking for interns who are interested in every single aspect, no matter their specific career track.
So if you're wondering what are some of the benefits of our program, not only can you learn about some of the various aspects of healthcare, both in clinical and administrative, but we can help you build your soft and hard skills, including your independent and teamwork skills, and also provide you with clinical and patient exposure. Some of the other extra benefits we could teach you within the CAP program is experience with the EPIC program. We can provide professional growth and career development opportunities, networking with healthcare professionals, and potentially the shadowing program within UCR Health. And right now, could we have Celia talk about our various departments within the program?
Yes, thank you, Brian. So these are some of our clinical departments. I'll start with Citrus Towers, which is our multi-specialty clinic, where we have providers within cardiology, primary care, neurology, and endocrinology that see patients out of multi-specialty clinic at Citrus Towers. We have our women's health clinic at Silver Oaks, which is our OBGYN physicians. We have an maternal fetal medicine physician is there, as well as some surgeons. We have our neuroscience clinic at Riverbrook, which has our pain management and neurosurgeon there. And then we have our psychiatry suite at Citrus Towers as well. Some of the administrative departments that we have as well is marketing, project management, data analysis, our quality outcomes, billing, credentialing, compliance, and information security. Some of the responsibilities within the clinic, I think it's important as you get into healthcare, whether you're going into pre-med or you want to get into health administration, is really understanding everything from the front to the back. We all work as a team, and it's very important to know how that team runs. So you'll learn anything from scanning, scheduling, registering patients, insurance verification, room turnover, how to handle phone calls, especially within our multi-specialty clinics and in our women's health clinics.
So now we'll have one of our interns, Natalie Cooley. She's our current CAP multi-specialty clinic intern. So Natalie, you can go ahead and talk about some of your experiences working as an intern with us.
Hi everyone, I'm Natalie. Thanks, Anuja. So I'm a third year biology major interested in pre-medicine. So I began CAP during the first cohort in January 2020. And I began at the Women's Health Specialty Clinic. So at this clinic, I was mostly interested in the OBGYNs because that's what I want to pursue in the future. So over here, we have a variety of OBGYNs, and it was a great experience. I worked in the front desk. And so this is where, as Celia had previously stated, I built relationships with patients based on phone calls, getting their information down, registering them, going through insurance verification, and at the same time, you also build a relationship with the physicians there because, as Cecilia stated before, it is a very front to back relationship. You have to know throughout the whole clinic the flow of it. And so as an intern here, you definitely understand how each person works together, not just the physicians, not just the front desk. Not just the front desk assistants, but everyone in its entirety. And so I began the multi-specialty clinic about a month ago because I already done a year at the Women's Health Clinic. And so multi-specialty also runs in that same order. I am still working in the front desk administration while also getting to know the physicians. And it's also nice because they teach you along the way some things about patient care, and then you learn more about direct patient interaction as well. All very important things no matter what profession you decide to go into in the future in pre-health. So yeah.
Thanks, Natalie. So yeah, go ahead, Celia. You can talk about the next two clinics.
Yeah, so in psychiatry and neuroscience, just as Natalie's mentioned, there's still the same kind of clinic responsibility as far as scanning, scheduling, registering patients, and the interaction with patients.
And so now we're going to be having our next intern. He's a neuroscience clinic intern, Manbir Sandhu. So go ahead. You can go ahead and talk about your experiences.
Good morning, everyone. My name is Manbir Sandhu. I'm a third-year undergraduate student at UC Riverside studying cellular, molecular, and developmental biology. I joined UCR Health as a neuroscience clinic intern in September 2020. And just as Natalie said prior, I remember Celia, our director of ambulatory operations, telling us how by the end of our internship, we would understand how everything works from front to back and back to front in healthcare settings. And I'm grateful to have been and am playing such a vital role in day-to-day clinical operations, especially during this pandemic. And the neuroscience clinic really definitely piqued my interest because the last 2 years I've been researching in translational neuroscience at UCR. So it was really nice to see the research aspect, the pharmacological side of neuroscience, as well as like the administrative and clinical side. So my duties include scanning, printing, helping complete charts, putting them into Epic. That's the software we use at our clinic or all throughout UCR Health, helping schedule surgeries, calling patients, mailing letters, picking up mail, mailing other documents, and everything and all that goes in between all of that. And also like turning over rooms, sanitizing, putting down like social distancing markers around the clinic. So it's just been a great experience. And also like my mom, she's a patient of the UCR multi-specialty clinic. So like having like a family member that is a patient at UCR Health, it's definitely really rewarding to help out at UCR Health, because I like treat every single thing that I'm doing like it's the most important thing, because it is. And when you have patients that are coming to us for help, making sure that everything goes smoothly for them and making sure all of their documents are in the right order, everything's correct, it just takes off the burden of what they're already going through. So I'm very grateful to be serving as an intern at UCR Health. Thank you.
Thanks, Manbir. So now we're going to move on to the administrative department. So Celia, you can go ahead.
So as I mentioned before, some of our administrative departments, as is marketing, you'll be doing digital website and newsletters, physician profiles, and social media platforms, which was really important when we're onboarding our physicians. We work really closely with them to get their profiles and get them on social media. Our data analysis, you'll do data extraction and management, create measurements for clinical projects and Tableau reports. So you'll work closely not only with the clinic managers, but sometimes the chairs of the departments. Project management, working closely with the COVID-19 hotline, COVID-19 vaccine clinic, and our COVID-19 case investigations, which is a really important role right now as we're still going through this pandemic. And then quality outcomes, working with our COVID-19 drive-through testing, and then the flu vaccine and credentials.
Great, thank you. So before we go into more of the administrative departments, we're going to have Namrata Shetty, our CAP marketing intern, also talk about her experiences in the administrative department side.
Hi everyone, thanks Anuja. My name is Namrata and I'm a third-year biology major. I'm currently on a pre-medicine track and I joined CAP in June of 2020, so the summer of last year. I joined CAP as a way to get kind of a holistic perspective on healthcare and the behind the scenes of an organization so big like UCR Health. So I was super excited when I got placed into the marketing department and have thoroughly enjoyed my experience so far. I work remotely 8 hours per week in my designated department, and I'm tasked with creating social media content that aligns with the copy design and marketing campaign of UCR Health. I've learned programs such as Canva and Qualtrics. I also write blog posts for the UCR Health website, help onboard physicians, work with the UCR Health Women's Health team to revamp their social media presence. So creating a lot of that social media content that you see on Instagram, Facebook, and other like LinkedIn, other social media sites. And I've also been a part of a team that brainstorms creative marketing projects, such as video profiles for our UCR Health medical professionals.
Thanks, Namrata. So go ahead, Celia. We have some of our newer departments.
Yeah, so this program has really expanded and more of our departments are asking for CAP interns. And so these are some of the newer departments that have requested some CAP interns. Our compliance and information security. So School of Medicine Compliance Advisory Services website, they would like to be worked on. Website, blog, and compliance newsletter, auditing and compliance work plan. Along with working on policies and procedures. We look at them every year just to make sure they're current and up to date. Billing, reconciling surgeries, pulling operation reports for surgeries, pull face sheets and reports for cardiology for St. B's, and scan paper batches and file and folder and S drives. And then credentialing. creating workflows and protocols, tracking delivery and utilization of vaccines, peer review, and the credentialing process.
Thanks, Celia. So now we're going to go into what are the other components of CAP in addition to your assigned department. So whether you're going to be assigned to a clinic or an administrative department, we do have other components of the program that and that we offer different benefits for you guys. So one of them being the mentorship program. So that's where we have our newer interns paired with fourth years and alumni, just to get that kind of interaction with our UCR students and learn more about maybe your mentor's life, career, track, and just kind of create that bond with them. And then as you become more of a seasoned CAP intern, then you can have your own mentee as well. Next being our professional development series. So we try to have as many different guest speakers as possible and host different workshops and allow all of our interns to network with these different healthcare professionals. So in the past, we have been able to get our CEO of UCR Health, Dr. Donald Larson, our COO of UCR Health, Ms. Catherine Hansen, and our Dr. Emma Simmons, and the CMO of UCR Health, Dr. Andres Gonzalez. So we've had the opportunity to work with a lot of people. Our interns have been able to speak to them directly and interact with them and hear about their experiences. So we're really excited to continue that in the future with CAP. One of our third components is their shadowing program. So after working as an intern for about 6 months, you are eligible to apply to our shadowing program as part of CAP. So, and how this works is you can either choose to work for a physician, shadow a physician, or any other healthcare professional that works in the administrative departments. And again, this is a different application cycle that you would have to apply for and be offered the opportunity to do so. Our fourth aspect is our community outreach program. So we do have our interns work with local high schools and present to them about different health careers. Part of our goal is to not only educate our current UCR interns about clinical administrative aspects, but we want high school students who are coming into UCR or different colleges to also get that idea and kind of think about that really early on. And then our last aspect is leadership and our committee teams. So we do have the opportunity for interns to apply to our leadership team, as well as get involved in our committees that are catered towards administration, professionalism, operations, public relations committees. So in addition to your duties as a clinic intern or administrative intern, you do have the ability to work in a specific committee if you're interested in maybe a different department. So if you're a clinic intern, but you really want to learn more about marketing, there is a way to do that with CAP. So these are just a couple pictures of our professional development events. So as you can see, we've had all of our events on Zoom so far since we've been remote. But yeah, so we've been able to have different speakers and we're really excited to continue. So now we're going to have our alumni speaker, Imad Jobah, talk about his experience. He's currently our alumni advisor, and he was the former CAP director and actually founder of this program. So we're really excited for him to talk about where he is now.
Thank you, Nuja. So I don't have to share that information since you just shared it. Thank you. I just graduated UCR this past spring, and so I'm one of the first alumni within CAP. I started with CAP in, I believe November of 2019, and I'm currently a University of Washington MHA student. So I'm a first year in this program, and it's the Health Administration Master's Program within UW. And so within my experiences with CAP, I honestly can speak for hours about how I've enjoyed CAP. Just some of the experiences that I learned, I think that also incorporated with my experiences now in grad school is the teamwork that I was able to develop within the leadership team. So I think that was a great opportunity for me to experience and collaborate with other people. The second thing I would say is the public speaking opportunities that I gained from the workshops and the professional development series that I did when working with the students and also the professionals that we had. The third thing would be my project management skills that I developed through creating CAP and also starting off as administrative intern with the Quality Outcomes Department in the fall of 2019, but then also becoming the director of the program and kind of developing the curriculum that we now have today. And so I would say shortly my favorite things about CAP, just experiencing, I think, or developing something for interns within a clinical and administrative experience. It's something that we don't have at UCR. And I think more people can learn about what healthcare administration is because of how important the field is. But also as clinicians, it's important to know what the behind the scenes looks like. And so it's really great to have these answers whenever you're applying to grad schools within the interview process, but then also the application as well. And then also the networking and building connections within everyone I worked with. And so I think the mentorship program and the professional development series is a great opportunity for that. And Anuja talked about that in the previous slide. Some advice that I would give to the interns that if you're interested is to remain with an open mind and a growth mindset when you're experiencing your internship and taking on new opportunities and taking the initiative that your supervisor tasked you with. Be sure to review your application and refine it as much as possible. This is a very competitive process, and so I would highly encourage that. And then be yourself when explaining your passions and goals for this internship and what you actually want to get out of it is really important. So thank you.
Thank you, Imad. On that note, I'll be talking about our application components as well. So the first thing we ask of you is a headshot, just so we have a face to the name, your unofficial transcript, a resume, 2 professional or academic references, and 4 short essay responses. And the application cycle is now open. If you wish to find the link as well, you can find it on our SOM website, or we'll have it on all of our marketing and promotional flyers. We're right now in the process of switching to Qualtrics, so if you don't see it today, please give us a little time and we'll have it out most likely by the end of today or tomorrow. The deadline for our applications is April 18th at 2021, and our interviews will begin April 27th to May 17th, and we'll have acceptances or letter of acceptances out roughly around the end of May 2021. And the program length would be the entire academic school year, so be expected to start in roughly June 2021 to June 2022. And if you would like to contact us, our email is at ucrhealthcap@medschool.ucr.edu. Please follow our Instagram at ucrhealthcap, and our LinkedIn can be found here. Oh, so sorry.
Yeah, so before we get into questions, we will be having a Q&A session. So for all of you interested in asking questions, you can go ahead and do so. But before we get started with that, I just want to inform all of the people kind of joined in the middle of this event. We have been recording this event, and this will be posted on the HPAC YouTube channel. So again, if you missed like the beginning of the event, or if you have any friends who missed the event, they are more than welcome to see this event on the HPAC YouTube channel. It should be posted in about a week from now. But yeah, so if you guys have any questions, go ahead and just type it in the